All right. We have a quorum. Yay. All right. We have one, we have a similar situation. We haven't yet elected a chair or vice chair, but Councilmember Reed, I really liked your suggestion last meeting that we have one of our members as the chair for the meeting rather than have staff do it. So I would greatly appreciate it if someone would volunteer to chair tonight's meeting so that we actually have one of our members being the chair. Is somebody willing to take that on?
I'll take it on if no one else will.
Thank you.
Thank you.
We appreciate that. So I guess we can then get started.
We can.
Yeah. Mm-hmm.
Yes. All right. Well, I'm sorry. We may need a motion to meet virtually, so I'll entertain a motion to hold the virtual meeting.
I move to hold a virtual meeting.
Is there a second?
I second the motion.
All right, and then we can do a roll call. Ms. Flex.
Sue.
Present.
Thank you. Amanda Gola.
Present.
Thank you. Samantha Fry.
Present.
Councilmember Burns.
Aye.
And Councilmember Reed.
Aye.
Thank you.
All right. Well, then we'll continue moving on. The first thing on our agenda is I'm sorry, is this September? Yes, new member introductions.
So we have one new member joining us. I'm sorry, I thought we would have two, but Samantha, would you mind introducing yourself?
Yes, Samantha Olds Fry. I'm live in the 4th Ward of Evanston. My background is public policy and administration and economics, and currently and Medicaid healthcare policy by and large. So excited to be here.
Welcome to the committee. And then who is staff? Who is the other new member that wasn't able to make it today?
The other new member is Cherie Lackey.
Yes. Okay, then we will continue on. The next item on the agenda is approval of the meeting minutes from September 9th, 2021. So I'll entertain a motion for that.
I move that we approve the minutes from September 9th, 2021.
I second the motion.
Great. And then we can do a voice vote on this. So all those in favor say aye.
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 Any opposed?
Aye.
The ayes have it with none opposed. And then we'll move on to public comment. So if there's anyone in the chat room here that wants to join public comment, I think we can see if you raise your hand. So if you want to raise your hand for public comment, one of the staff members can promote you to panelist. All right, seeing no hands, we will move on. If there's a point later on in the meeting that folks really want to chime in, I will allow space later, but let's continue on. Let us see. Okay, well then the next thing on the agenda is the election of chair and vice chair. The Social Services Committee. So let us see if, is there anyone interested in serving as the permanent chair, or no, not permanent, but at least we can set our own terms for this. I suppose that the terms can be anywhere 6 months to a year to serve as chair. So if anyone is interested in serving as chair or co-chair, feel free to chime in.
I could serve as chair if no one else wants it, but happy to vote for anybody else. Or nominate you.
Oh no, you're okay. Well,
Now, one of the things, excuse me, Council Chair Reed, I just wanted to point out to our members that the chair by our ordinance must be one of the volunteer members, one of the citizen members, not our council members, based on this type of committee. So we really do need to have at least a chair. So I'm hoping that we can get someone who will be willing to volunteer.
I will.
yeah, I'm not sure if this committee, I know HCDC, or I don't know if this committee does, but certainly Samantha has volunteered to be chair. So Samantha, so certainly I will entertain a motion for Samantha to be named chair of Social Services Committee.
So I'll do the motion for Samantha to be chair of this committee.
I'll second the motion.
And do we want to define a term? We 6-month term?
We can, of course, change it, but in the our article, Administrative Rules and Procedures, we had followed the standard sort of committee thing, which was to say a year-long term. I just wanted to point that out. We can change it, or somebody can.
Well, I think we haven't even adopted those as our rules.
No, I just
yet.
wanted to point that out.
But yes,
so if
that
we
is
do
what is written here. Yes. Okay, so for a year term, or for what length?
I'll do a year, Samantha.
Sounds wonderful. Thank you.
Yeah, I'll second a year.
Okay. Then I will, we can have, if there's no further discussion, we can do a roll call vote on that. And is this to take effect? Am I handing over the gavel now, or are we starting this at the next meeting? How do we want to handle that as well?
I will leave that up to the two of you. Samantha, do you have a preference? Do you want to take over, or would you like to?
I think Councilmember Reed is handling it quite well today. And it will give me a few minutes to catch up on Robert's Rules of Order.
Okay, then we'll do that. We'll have it start at the next meeting. All right, so I'll entertain, if there's no further discussion, I will allow for a vote on that. We can do a roll call.
Thanks. Amanda Nagola.
Aye.
Samantha Oldfry.
Aye.
Archna Snood.
Aye.
Councilmember Burns.
Aye.
And Councilmember Reed.
Aye.
Thank you.
Okay, continuing on with the agenda is the approval of the administrative rules and procedures. So if staff wants to make any statement regarding that, I'm sure folks have had an opportunity to, at a minimum, skim maybe the rules and procedures.
Thank you, Councilmember Reed. I'll just say a little bit about it. Sarah Flax, Housing and Grants Manager. What we tried to do was make it clear what the responsibilities of the committee are right now in terms of the funding sources and things, but kept it open because there is always a chance that other things could be added. And that's why there's and any other funding source that City Council deems appropriate to, we are aware that we may have ARPA responsibilities in this committee, so I just want to point that out. And otherwise, it's a pretty standard format that is used for our boards, committees, and commissions. Talks about our powers and duties, conflicts of interest, and terms of office, all that good stuff. One of the things that we do want ultimately, but to in addition to this, is for the committee to develop a work plan, sort of its priorities. But that's to follow on that, because one of the things is we don't want to put so many details into the administrative procedures and regulations about what specific topics are of particular interest or what, because then it changes and it makes it complicated. We don't want to have to be revising these every year or every half year. But if anyone has any questions or would like to ask for any changes or anything, please let us know.
All right, seeing no discussion on that. Thank you, Sarah, and thank you, Sarah, for presenting and getting this all done. So I will entertain a motion to approve and adopt the Social Services Committee Administrative Rules and Procedures.
I motion to adopt the rules and procedures, Social Services Committee rules and procedures.
Yes. Is there a second?
I second the motion.
All right, great. Any further discussion? I will say that I'm looking at, and I just want to, make this clear for the future. It seems like any member of this committee can serve as chair or vice chair. Sarah, do you want to provide clarification where you think different?
It's actually in the ordinance, and I guess we probably, maybe that is something that we should add into this.
Yeah, and I think it also on the webpage. I do know that I know we're switching over to another system, it seems like, for the newer committees.
We are.
Yeah, and I'm sure but on the previous committee pages, it typically links to the authorizing or to the ordinance or resolution that authorizes a committee. And so, and I noticed that wasn't linked for this particular committee. I was looking through both HCDC and this committee yesterday. And that's actually why I'm under the impression that any member of the committee, from my reading of the ordinance yesterday, can serve as chair or vice chair.
Yes, and thank you, Councilmember Reed. That's a really good point, because we're following the sort of template, and we'll recommend that be added to all the boards, committees, and commissions, because what we didn't, they were trying to revise the format to make them a little more accessible to people, because the old format was about half of the ordinance with not a whole lot of consumer-friendly language about what the committees were responsible for. But I think that's a very good point that you make, that we should put that on there. And I am going to pull up the ordinance just so that I can confirm.
Yeah, and I mean, it's not an issue now, but
yeah,
just for the record, for the future, so it's we don't start off with some confusion.
You will
but
make
it is
a note
rule.
that it should be joined. It should be attached. Absolutely. Thank you.
Yes. Mm-hmm. And then I will also, if there's nothing else, I have one amendment to the rules here to make, which is section 4. I would like to say, unless inconsistent with these administrative rules and procedures or otherwise decided by the board, all meetings shall be conducted in accordance with the rules of the city council.
I'm sorry, section 4 of which article, please?
Oh, I'm sorry. Yes, section 4, article 5.
Okay. Okay.
Okay.
And-
I'm pulling the document up. Would you mind repeating? Give me that language one more time, please. I
Yeah,
apologize.
it's section 4, Article 5, Article 4 of 5, Section 4. Unless inconsistent with these administrative rules and procedures or otherwise decided by the board, all meetings shall be conducted in accordance with, and instead of Robert's Rules of Order, the rules of the Evanston City Council.
Councilmember Reed, I just wanted to point out that we were advised by our legal staff to have it default to Robert's Rules of Order. I don't have a personal preference or anything like that, but can you tell me what the significant differences are, just so that we know? Because
Well,
we'll have to learn.
there isn't a significant difference, but as the committees are subcommittees of the council, and
Right.
the rules of the council would theoretically automatically apply to a committee. And for example, the council rules have a few things that are different, such as the ability to hold items, which is not an ability in Robert's rules. And wherever those rules are silent, the council rules, Robert's rules takes over. So it's essentially the same, although it creates some consistency with what folks might be used to at the council level.
Okay, so do you think we should delete the Robert's Rules of Order and just say shall be conducted in accordance with rules of the city council? Because then if there was something that wasn't in the rules of the city council, it would default to Robert's Rules of Order after that anyway, right?
Yes.
So,
Yes.
okay, I just want to make sure that we're doing it and not leaving anything out.
Can I ask a question?
Sure.
Where would we learn the rules of the city council? Like, how would we know what those are as regular citizens?
Oh, it's on the city's website, and certainly we can
We
get
will
that out in the. I'm sure I can share it with Sarah. Or Sarah has access.
We've
to it.
downloaded and
Yeah.
we will just send it to all the committee members. That would be, I think, a very good thing to do
Yeah.
for everyone. So we'll be happy to do that.
Okay. I'm sorry. Well, I would need a second to that motion, and then we take a vote on it. So if there's appetite from the committee to do that, then
I'll second the motion.
all right. And then we can do a voice vote on that amendment.
Amendment. Mhm.
So all those in favor, say aye. Aye.
Aye.
I-
All those opposed? All right, then that amendment is adopted, and then we can move on to the actual motion, which was by Ms. Oldsfray. So without further discussion, we can take a vote on approving the administrative rules for the Social Services Committee. We can do a voice vote on that as well. So all those in favor, please say aye.
I,
Aye.
Aye.
Anyone opposed, please say nay. All right, that is adopted unanimously. Continuing on in the agenda, the next item of business is approval of proposed classifications of funding applications. May I entertain a motion for approval?
Is it possible to have some discussion on this matter?
Well, so yeah, that's making the motion for approval, or in some direction, is how we begin the discussion.
Okay.
so are we making a motion to discuss or a motion to approve?
A motion to approve, and that allows us to discuss, and then we can vote based on after. Or you can make a motion to not approve.
Okay, I'll make a motion to approve the proposed classifications of funding applications.
Is there a second?
Second.
Great. Okay. I'm sure Sarah or Jessica,
Actually,
you have.
Jessica has a brief presentation to take you through, and so I'm going to let her take over if that's all right.
So
Thank you.
bear with me while I present. All right, so bear with me while I skip through now that I'm here. So glad we got through so many of our agenda items. The new classification system is based on our new service delivery model. So staff classified applications to align with the changes in funding priorities, incorporate the City Council goal of equity in all city operations, and to support COVID recovery efforts. So ideally, the process will focus resources for greater impact by moving from a long-established system that funded agencies for programs that provided individual services to a client-centered service delivery model that empowers people facing systemic barriers to be meaningfully involved in determining what they need to achieve economic self-sufficiency and improve well-being. We're not counting numbers of services delivered, rather success is measured over a longer term. And so we've talked about holistic case management, and the purpose of this slide is to review the requirements as described in the application process. So all services have the case management elements, but a really holistic case management is designed to deal with people and households with complex needs, because those case managers are able to connect households to services and track the provision of services, not just make referrals. Safety net services, again, are defined by that immediate provision of low cost or no cost services, usually for basic needs, but not always, to address a specific hardship. And then support services, it's important to note that we have not opened up the application process for support services. We haven't solicited those applications, but the applications that are currently classified under that banner of supplemental services are there because they don't fall easily into case management, the holistic case management, or safety net. It's unclear that the people served are in case management relationships, which could make the services eligible under that case management designation. So now let me share another screen with you. And this screen will be the list of applications as designated with those classifications. It's getting easier, guys. Thank you for your patience. Okay. Can everybody see this screen as it is?
Yes.
Perfect. Okay. So we have here our case management applications designated in blue. So for example, Books and Breakfast, North Shore Senior Center, and CNE, even though they're currently under safety net, these applicants originally applied as case management applications, but the classification that we have lists these applicants as providing holistic case management. The applications in light orange applied as safety net, but again, we're classifying all of the applicants currently under this safety net services designation as safety net services. And then these applications under our support or supplemental services, we believe based on the applications, fall into this classification, but we're happy to hold a discussion or answer questions. So our intent really is to just have a discussion and see how committee members felt about these classifications.
So this is Samantha. From my point of view, actually.
Oh, you know what? I'm sorry. Let me mute. I apologize.
Okay, go ahead, Samantha. I'm sorry.
Oh, no worries. So I think this makes sense. There were a few applications that didn't necessarily align with how they had applied. However, they're very good programs, very important programs, great work. It just not necessarily fell into the classification of the application. So I think that the realigning, especially of some of those that applied for the case management and moving them into the other categories, makes a lot of sense. It was very difficult to compare a service that just wasn't holistic case management, although an absolutely, strong program that either fell into safety net or potentially the support supplemental services, to true holistic case management. So I think this realignment is logical.
Yeah, I'm in support of it also. I think it does offer an opportunity for programs to be funded that are really valuable, even if they aren't falling into those categories. And I think the ways that they've been reclassified does seem to fit with the ways that we're doing it. And I also agree with the reclassification of funds, the percentage of funds available for each category.
All right. Anyone else? I will, if no one else, I will also add that the buckets or the three classifications here seem to make sense, and I am also in support of moving forward with this. And does this? I'm sorry if I missed this, but does this lock us into these committing these dollar amounts to these to the various classifications?
No, we really just were providing it as sort of a guideline. And one of the things, quite frankly, that didn't surprise us is that more applications fall into the safety net, partly because of the COVID environment where a lot more safety net services are needed. And also because we were asking agencies to look and categorize themselves in new ways and apply in new ways in the middle of a pandemic too. So we put an awful lot of work on our agencies, and trying to figure out where you fit and all that stuff is, it's more than, it is not that we didn't anticipate that we would be in COVID-19 crisis mode when we went into this change. So, I mean, I think the work they did was amazing. And our goal is to, nobody is absolutely locked in any one category forever. Some of the organizations may want to modify their program over time, but one of our concerns is if they're not doing robust case management and doing more than the case management with their own type of program, then they really aren't going to be tracking the measures that are going to be used on that, and they won't be evaluated fairly for the type of service that they're providing, which, as you pointed out, is really valuable. And we don't want that to be working against them or the system of evaluation, because we really are trying to strengthen our assessment of how our funding is actually helping people. So.
Thank you. Please, or is Councilmember Burns in the call? Or did he have to? Oh, if we can raise Councilmember Burns back to panelist.
My apologies. When I'm sharing my screen, I can't see who's under the.
Yeah, no. Yeah.
So,
and Councilmember Burns, I just want to make sure that we get any of your feedback since you weren't as a panelist.
Yeah, I'm good.
Okay. All right. Well, then I think we're approving this now and not giving direction to you. So I guess I will we can, with no further discussion, we can take the vote on approving this classification scheme. So can I have a roll call?
Yes, please. Apologies. Samantha Olds-Fry,
Aye.
Amanda Nagola, Archana Sood,
Aye.
Councilmember Burns,
Aye.
thank you, and Councilmember Reed.
Aye.
Thank you.
Okay, great. We can move on to the next item on our agenda. We're chugging through this meeting. It's the 2021 allocations next steps. And so Sarah or Jessica.
Thanks so much. I'm going to take that also. And it means sharing my screen again. So here we go.
And as we're getting into that, can I have a motion to move the discussion on the 2021 allocations?
So moved.
Moved by Samantha, I believe, and then seconded by.
I'll second that.
All right, thank you. All right, thank you, Jessica.
Thank you. Okay, so I just wanted to outline some general requirements. And these are requirements that all applicants need to follow. Staff recommends that agencies not able to follow the general requirements are not approved for funding. We use these federal requirements to provide consistency, and the requirements offer comparable ways to measure populations served, even though those populations might be very different. And it provides consistent data structure. We also have, even though we're considering this one funding opportunity, we do have several different streams of funding that come with their own requirements. So CDBG, our first category, must be spent in calendar year 2021. We are able to fund agencies retroactively, so that's very helpful. So some applications for existing case management and safety net services do meet this requirement and can be funded for their work in calendar year 2021. Our CDBG CV funds must be used to prevent, prepare for, and respond to COVID-19. So that means they have to prove that COVID-19 tieback, and certain applicants made it very easy for us because they talked about expanded services as a result of COVID-19, but that tieback component is critical. And finally, we have our local human services fund, which is a little bit more flexible, which is great. Two applicants applied for services that either enhance holistic case management or are new services that they might not have been able to start in January of this year. So one of the nice things about the flexibility of our local funds is that it would allow us to, if those applicants were selected for an allocation and eventually an award, it would allow us to fund them moving forward in 2022. So funds can carry over. And for supplemental or support services, again, we can use local funds to work out like a fee for service agreements so that the city can pay for services received. And I also just wanted to point out, I'm sure all are aware, but one agency did withdraw their application. So next steps would be for committee members to score the applications and make allocation recommendations. Staff can then provide the averages of those allocations. And we've used the scoring feature in the past to sort of determine allocations should the committee want to. So for our allocation hearing night, staff can provide those initial allocations that are the basis for the committee's discussion. But moving forward, at the discretion of the chair and the committee, the chair can nominate a working group, 2 members of the committee, to determine, again, based on averages, sort of allocations for that initial funding discussion. And that's all I've got.
And I just wanted to elaborate a tiny bit on that. The Mental Health Board made really good use of that scoring tool to sort of form the basis of letting everybody know a starting point. If you start from 0 and you just start, who thinks, how much should we give this one? It gets really confusing or challenging. And the other thing is, it also, in the past, the agencies also liked that they got more feedback and from that on, how they were ranked, and that can be valuable to them. It is not meant to constrain the committee in any way, shape, or form. It's just to do a starting point. The Housing and Community Development Act Committee had its own version of that. They didn't use the scoring tool, but we again gave an average. It's just a way that we think would be helpful to the committee to start from, and then you have the ability to discuss what you agree and don't agree with based on that, rather than just, as I say, starting from ground zero. But it is not in any way meant to constrain your ability to change any of those or work from those. So, but if that would be helpful, we will be happy to do that and get all of that to you in the packet in advance of the meeting in October, which is on October 14th. Is that right? Yes, 14th. Be terrible if I tell people the wrong meeting date. So.
Okay, thank you. I will now entertain any comments or feedback from members of our committee. Samantha, I see that you are unmuted, so I presume you may
I
be geared
do.
up.
I have a question, although I think Amanda, did you as well have a question? Okay. Thank you. For the scoring, obviously the applications are currently sorted by the category of which they applied. Will they be moved and we score based off of the designation that we just approved?
So we're not able to move the applications in Zoom grants, but yes, it is staff's hope that the committee will score based on the designations.
One of the things we could try to find out and see, one of the interesting things about Zoom grants is we do not have access to be able to change anyone's application, of course, because that's one of the securities in the system. But we could open up and ask if the organizations that we're moving would be willing to, it's a copy and paste thing from one to the other. We can certainly see if that's something that they can do, or we may even, there might be a way that can be solved technically by Zoom grants. I'm not sure, but we'll be happy to follow up and let you know that, because it would be helpful if it's all in the right category. We realize that doesn't help you, and it will be pulling data out and doing pivot tables and stuff with it. So, and it would also then put them in the correct category for reporting, because their reporting is going to be done in the system too. So we discussed that, and that's a very good point. We will see if we can get those changes made.
Thank you for that
Great.
clarification.
Yeah, my question was similar. I just wondered if we needed to redo our scoring because, you know, for example, the safety net now has a lot more money allocated to it. And so I know when I was working with a different number, and so I may, if there's more money allowed, I may change some of my numbers. So I wondered if we should redo some of those.
We can definitely do that as well. And we'll try to make it as close to being able to do everything in the system with those estimates. But again, you know that you're not bound by those estimates, even though that's an important thing. So we will get to work on that tomorrow with the agencies and see if we can get that done absolutely as quickly as possible for you.
And then is there a timeline for updating the scoring that would be helpful for staff prior to the October 14th meeting?
Of course, instantly would be wonderful, but we know that's not possible. Let us get back to you with what we can do, because I don't want to put demands on you before we can even promise we can deliver.
Perfect. Thank you, Sarah.
Great. Is there any further comment from members of the committee? No. And Councilmember Burns, I see Ms. Sood doesn't. Councilmember Burns. Okay. Well, thank you, Sarah and Jessica, for that. We will move on to the next, which is staff report. And also, now that we've gone through our agenda, since we didn't have public comment up at the beginning, after item 10, I will give a brief period again for public comment if there's any reaction, since we have a lot of folks on this call who are deeply entrenched in this work on a day-to-day basis. So we can move on to the staff report. So may I entertain a motion to discuss the staff report?
So moved.
All right. Is there a second?
I'll second.
Great. All right. Is this another Jessica special, or is it Sarah?
It's another Jessica.
Okay, great.
I apologize. I think that we covered everything in our staff report in my initial presentation. So I probably should have just taken that right off.
Oh, great.
Sometimes we put that on as a catch-all if we have something that we haven't put in the packet that is just information. So
Yeah, great. Okay. Well, then I will again open it up for a few minutes of public comment. If there's anyone in the attendees that would like to make any comment or any notes, you just raise your hand and I think it will become visible on my screen. All right. Seeing again, no comment. Certainly feel free to reach out to myself and members of the committee by email or other sources to share any feedback. And we will be happy to read that and respond. Okay, well then with that, seeing no further business before us, our next meeting is, again, Sarah, if you don't mind repeating it.
October 12th.
October 12th.
Second Thursday at 7 o'clock in the evening. And we will be doing it by Zoom again, we expect.
Right. And we will have our wonderful chair, Samantha Oldsfray, installed and looking forward to continuing business. I'm sorry, go ahead if you're going to say anything, if anyone else wants to make any
I'm sorry, Thursday, October 14th.
14th. Oh, great. I'm looking at the wrong month. It's a good thing we double checked.
Great. Okay, well, with no further business before us, the meeting of Councilmember Burns.
Yeah, just one last thing. So I was traveling back home and phone was cutting off on and off. So just want to be clear. So next meeting, what do we expect to be on the agenda? I'm just trying to figure out what I missed. I missed a bit of the conversation. Sorry.
It will be the allocation of funding in the two categories that the case management and safety net. So we'll the committee will be making its recommended allocations. Those recommended allocations will then go to the Human Services Committee and then on to City Council. We also reserve the flexibility because Human Services Committee sometimes doesn't meet on a schedule that works real well. We bump it to APW or P&D if that expedites getting it to council. So we could make that recommendation.
Okay, thank you.
Okay, thank you. We'll see each other on October 14th. Yeah, great. All right, have a good night.
Thank you, everybody. Good night.
Thanks, everyone.